All right, guys, so I'm back. So yes, my previous video, part one, did cover my clinical rotations on the cardiac unit, the OR, the GI lab, and a drug addiction treatment center. So my next, I'm gonna cover in this video like the rotation that I just came out of. So on Tuesdays, I did my rotation on the oncology unit on Surg, and then on Wednesday, I did my rotation at labor and delivery. Yeah. So, anyways, I'm just so like amazed by starting clinical in September, and like September, October, no, like 3 months later, like knowing just the skills that I have gained, and just the comfortability that I've also gained, and the confidence that has built over time is just amazing. Like in 3 months where I felt like so clueless, but now I feel like, man, I could be somebody's nurse. Like I really can. So it's just been awesome. So let me go over some skills that I actually have learned, or I've actually done with patients, because you know there's skills lab and then there's like what have you done with the patient. So I am confident in giving IVs, giving sub-Q injections, giving IM injections, and transdermal. It's not transdermal, sorry, intradermal injections as well. So I've given like a PPD shot. I've given flu. I've given insulin, heparin. I've given a boatload of things. I have witnessed the implanting of a PICC line and giving medication through a PICC line. I also was able to do sterile changing dressings of a PICC line, dressings of a central line, putting in a folded catheter. I changing a ostomy bag, and I have done so much. You know, taking blood, starting up an IV, working with an infusion pump, doing a piggyback. Oh, I actually did wound care for a stage 4 pressure ulcer in the sacral area. That was interesting. I did a wet to dry. I also was able to do a wound vac for an amputee. Toes were amputated. I'm thinking of all the skills that I've done. I've done a lot over the time period. But those are the things that come to my mind the most. So, I mean, giving bed bath, ampulating patient, dealing with various odors, which I'm going to get into in this video. Anyway, so those are some of the skills that come to my mind. I feel like there's so much more that I don't remember. There are some cool things that I probably did once, and I don't remember them. I don't remember them particularly by name, but I'm thinking about them. Anyways, there's always time to give an update. So let me get into the video. It's already 4 minutes and I'm sorry. So anyways, this last rotation I've been on oncology, and so it was not a strange territory, because as I did my clinical rotation as a chaplain in palliative care and oncology, so the demographic wasn't brand new to me. Just being a nurse in those settings were like, oh, I need to switch my mind off. Like, I'm not a chaplain, but you can still give spiritual and therapeutic care in those settings, and patient loved them. We were given the challenge to take on 2 or more patients this time around, and I remember, and then one time we had to actually work as a partners and delegate. So like I would be like the nurse, and my classmate would be like my PCT, or I'll be the PCT and the classmate be the nurse, and knowing how to delegate and knowing the different roles and limitations of a PCT versus a nurse or an LPN. Like we had to learn those different thing and implement it in our clinical settings. I came across a lot of different disease processes in oncology. It's really a sad unit to be on, but I did get like develop my skill in time management and prioritizing one patient over the other based on what they were going through. Oh, also I did like pattern blood sugar on patients. So that's one of the skills I did as well. Yeah. Oh, mixing insulin, reconstituting IV drugs, like from powder to like liquid. So cool. Um, yeah. Yeah, I got to draw blood from the PICC line. That was awesome. I got to witness the PICC line being inserted. That was cool. But anyways, that clinical rotation really I love the patients that I took care of, and I feel like patients love me too, so that's good. The nurse felt like I wasn't a burden to the nurses. They felt appreciated. They felt like I'm like, listen, I'm here to learn and to grow, and I don't, nothing is beneath me. So whatever you need to throw at me, throw at me. I'm good. Like, I don't care. I shouldn't have said that because, I had an experience where a patient had an active diarrhea, and basically they were like pooping black stew. It was like slimy, and it's like we're trying to give her a bed bath, and then it was just like active, and I was like, oh crap. So you had to set her back down. Okay, you think you're done? No, you done? Okay, up, back down. Like it was a trip, but it was cool. Now let's move from med surg. That was cool. So message, I did learn to prioritize. I learned to, apart from the skills, just learning to prioritize patient, learning to manage my time to give my medications in the right time period. Also seeing the nurses knowing how to document, and seeing that documentation takes a lot of time. And I'll get into documentation in a little bit with L&D. So with labor and delivery, my first day my first day on the unit, I assisted with my first birth. Oh my gosh, it was so cool. She was a young mom, first baby, and just yeah, she had her water had broke. She came to the hospital. Like 4 hours later, she was 4 hours later she was about to have the baby. So once she was 10 centimeter dilated, I was in the room with the nurse. I didn't know the nurse, like literally the nurse does a lot of the job in L&D. A lot of the birthing process takes place with a nurse, and once the head of the baby, or is that she is, what is the word? I forgot. Y'all know the word. When the head is like about to come out. So basically when the head is like about to come out, that's when the doctor is paged, and the doctor rushing there, and everything is like, okay, give a deeper push. Come on, you can do it. So anyways, before that process happened, I'm like literally like holding the patient like the husband has one leg, I have the other leg, and I'm holding it, and she squeezed my arm. I'm like giving her words of encouragement, encouraging the dad to like give her words of encouragement, and I'm like, you can do this, you're strong, breathe, helping her do breathing exercises, like just encouraging her. It was just like such a beautiful sight. And then when the baby tag, what is the word? I keep forgetting. Anyways, baby head came, the doctor came in, and I switched place with the nurse, and I just watched, as this new life came into the world, and was just so beautiful. Let me just give y'all a warning, y'all. My girls, ain't nothing cute about pregnancy. Ain't nothing cute about it. Like, I'm like, I just didn't know down there could look a certain way. But boy, when that baby come through, when it's coming through, It's unrecognizable. I feel like the father's faint because it's safe down there. And it's nothing else. Like, I feel like it's faint because it's down there. But anyways, she was so strong. The baby came, and it was just so beautiful. And I, like, did the, Apgar test for the baby, and everything was fine. It was just so great. She had an epidural, so she was a little like tired, like trying to do skin to skin, but she was really tired, so the baby only did skin to skin for a little bit of time. And I mean, it was just great. I just like loved it. And then afterwards we had to get some postpartum care to her, changing her diaper, helping her go to the bathroom. Like, baby girl was, they gave her some medication because she was hypertensive. So but the medication like had her like out of it a little bit, and had her like vomiting, diarrhea, just bleeding heavily. It was just like everything. And just being able to like be a little bit of comfort to her in that time period was just like made my world. And just seeing like being able to be in that moment when someone take their first breath, it was just like awesome. I'm like, I might consider labor and delivery, but I know myself that I'll get bored of it after a while. So I'm like, no. But anyways, I did postpartum care with her. And a lot of times on the unit, I was in postpartum care. I got to see a C-section, which was really cool. It was way neater than I thought it was going to be. It was just awesome how the doctors would like do one layer, like the skin, then the fat, then the peritoneal area lining, and then get to the uterus and slightly cut the uterus, and the water just like burst open, and the baby come, and it's just like so adorable. My patients have been so sweet. I loved every minute of it. And I'm like, yo, and the incision wound was like so clean. I'm like, yo, I might opt to get a C-section, but the recovery time is like, whoa. But I mean, like, C-section post-op was like really great. Like, within a couple of hours, the patients were ambulated, and they were, breastfeeding. They are more engaged with the babies than the mothers who are on epidural, because it takes a little bit of time for the drug to wane off, and then for them to like feel like themselves and interact with the baby. Then I witnessed a natural birth. Girl was a G. Girl was a G. She didn't cry. Like, I'm seeing those like contractions. I'm like, whoa, almost 200 level, and you're not crying, girl. But she was a G. She only cried when the baby came out, and she was just like, I guess it's like, it's over, it's over. But it was just like really cool to see like a natural birth, epidural, C-sections, and just being able to provide post-op cares to those patients, being able to provide patient education about lactation, getting consultation on it, finding resources for those who are in like less advantaged area. Man, it was just like, it was beautiful. I enjoy labor and delivery. I don't think it's gonna be like for me, but it was just like an awesome thing. Like, that on that unit, that's when you practice like putting Foley catheter once epidural is given, or when it's time. Yeah, I also did a visitation in NICU. I got to see a 25-week-old baby that she was like 1.2 pounds. Not 1.2 pounds, like 1.2 kilogram, I think. Like 12-pound baby. I feel like it was even less. No, she was like 1 pound, 1 point something pound. And very small, like it fit in my arm. And just seeing that like little girl fighting for life, like, it was just like, oh my gosh. It made me think about like abortion. Like, I'm like, yo, she's technically in the stipulation where a person can still have an abortion, but seeing just like how that baby is formed, got her arms, her legs, her eyes, her heart is beating, her lungs is going, it's just like, I could not like get rid of that life. But yeah, it was just like seeing the babies in the NICU was just like, wow, these kids are so strong and so brave, and just like, man, I got to, while I was on my rotation, there was a mother who was giving birth to a stillborn baby, and it was just like, wow, it's just like so sad. You get to see the really joyful moments, and you get to see the really sad moments too. But it was overall, I liked the rotation. I liked that I was exposed to it. I liked how hands-on I was able to get, doing neonatal assessment, doing interpartum care, postpartum care. The nurses were all awesome. And I don't know, like when the patient's the most vulnerable and I'm able to give help, like I just feel like the greatest joy in it all. Like it's just like, wow, it's worth it. Like it's just worth it. Like I just love it. My last day on labor and delivery, the hospital rolled in a new like medical record, electronic medical record system, and it was like everything was kind of like out of whack. So it just shows you, it gotta expose me to like, wow, it's having a balance in a new system, and then having a balanced patient care, like, and knowing that documentation is like a lot of times what you're doing as a nurse. You have to document everything. What I like about labor and delivery is that they have computers in the room, so you can document and still spend time with your patients. Well, at that hospital. But it was really great. I enjoyed this clinical rotation overall. It's been awesome. I can't wait till next semester. We're going to be doing more critical care components in our classes. So I'm hoping that I get to do rotation the ER or the ICU. I'm just really excited about it. It's just so amazing. I'm just so excited about it, guys. It's just like really awesome. I loved it. And share your clinical experience. What is your best clinical experience? Let me know in the comment below. How was it your first day versus like your at the end of your first two clinical semester? How was that transition? Did you feel more confident in your nursing ability, or did you still feel like you don't know what the heck you're doing? Let me know. I overall feel like there was a tremendous growth from day one to now. I still know there's a lot to learn, but I just feel like, for a little bit, I feel a little bit better going to this profession. I feel a little bit better that if I pass the NCLEX in June, I'll kind of know what I'm a little bit doing, even though orientation is gonna be Bay. But yes, guys, let me know in the comments below. What else preceptorship's gonna begin the second term of spring. I signed up to precept in the ER or children's hospital or labor and delivery. So I'm hoping I am placed in one of those areas. I really, really, really do not want to do psych. And if I'm placed on med-surg, it's cool, but I really don't want to do psych or geriatrics. I love old people, but I I love young people more. Is that bad? I don't know. Is that bad to say? I just like babies and kids and teenagers and young adults. Not like preferring like my age group. It's just like I just like the developmental considerations that comes along with it. I just feel more connected and being able to be a light to those population. But I mean, geriatric patients are awesome too, and I love them. They're just the sweetest thing ever, and it's just really, 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 really sad population for me to work with. So I really like want to stay away from that population. But anyways, I'm rambling. Thanks to you guys for watching this video, and I hope you guys have a great break for those who are going on winter break, and I will be back with more nursing school update comes fall, comes spring. You'll probably see me post videos of different contents here and there, but as far as emphasis on nursing school, it'll be more so in the spring. Alright guys, let me know if you have any questions, comment, or video requests in the comment below. Bye bye.